My name is Mary Fallat, and I'm the current Division Chief of Pediatric Surgery at the University of Louisville, where I'm also a professor of surgery, and I'm the Surgeon-in-Chief at Cosair Children's Hospital. By virtue of my role as the chair of the Pediatric Surgery Advisory Council, I was invited to join the task force and I have continued to serve in that capacity as the Advisory Council chair. Dr. Oldham has also formed a series of committees as a result of this program, and I'm the vice chair of the verification program currently also. The pilot phase was important because this is a new program, and it's also an ideal program, so many of the different strategies are still being worked out. It was clear after the first set of visits that there is no program that's perfect yet. And so I think we took back the issues that seemed to be problems or concerns or questions, and these will evolve as the program evolves. And I think as we visit more programs, we'll find that if you've seen one program, you've seen one program. And there will be questions and concerns that are brought up that we will have to modify over time to fit the program's needs. But I think that there's no question that this is a program that's going to improve the care for the individual child in many places around the country. The biggest issue right now is related to quality of care and quality improvement. So there is no question that surgeons have always been concerned about complications and deaths and discussed them thoroughly, but there are many patients that are cared for by multidisciplinary teams, and those same complications and deaths are infrequently discussed by the multidisciplinary team. And our centers that train residents are also centers where there is great clinical care being provided by attending level physicians, and whether it's a training center or not, I still think that people will benefit from discussing and vetting things and trying to determine how we can do things better for patient care. Well, I have a little different perspective on some aspects of the program. And part of this is because I have a long background in emergency care for children in this country. I run the EMS for Children program in Kentucky, so I'm very familiar with all of our rural hospitals. And through that project, there's been an effort in this country to look at what kind of emergency care is being provided in emergency departments across the country. And even trauma centers fail to meet a standard for pediatric care in their emergency departments. And so this program, in parallel with that kind of an effort to raise all boats, as well as an effort to improve trauma care, are all parallel types of programs that I think are going to elevate the status of pediatric care in this country. And I know that there's a lot of angst in some parts of rural America and smaller hospitals where they don't have pediatric anesthesia and where many of the cases are being done by general otolaryngologists or general surgeons. And that certainly isn't a bad thing. I think people would rather stay home and get their health care if they can. But I still think there's room for improvement. And what this program will do is it will allow individual hospitals to look at their services that they provide for children and see how they can improve them. And then if they decide to rise to the occasion, then they will try to meet the standards for this program and apply for verification. I think the Surgery Children's Verification Program will improve care in this country. There's a lot of interest in the program, but to be fair, the interest right now is probably more on the part of freestanding children's hospitals and children's hospitals within hospitals. But as this program evolves, I see it becoming a more popular program, in one that, again, will improve care for children across the country.